Welcome to the ATiO Podcast, the ultimate gateway to first-hand insights from world-renowned experts in the realm of advanced therapies and orthopedics, unraveling the latest advancements and perspectives. Join us as we navigate this intricate landscape right here on the ATiO Podcast.
Today we have the privilege of hosting Professor Dr. Tobias Winkler and Michiel Bröcker, both founders and board members of the ATiO Foundation. Before we start, could you both take a moment to introduce yourself to our audience?
Yeah, with pleasure. My name is Tobias Winkler. I'm originally from Austria, but since 20 years in Berlin at the Charité, which is the largest university clinics here with 20,000 employees. And I run here the Department for Regenerative Orthopaedics and Traumatology, where we develop and identify products and new promising advanced therapies and transfer them to patients. That's basically my research and also my clinical profile as an orthopedic and trauma surgeon.
From my side, so I grew up in a mid-sized town in the Netherlands. Just to explain my background, which is a bit unusual, I came from a family of doctors, which led me to embark on a medical degree in the Netherlands. And I thought that was very interesting to understand how the human body works and what can go wrong and what you can do about it. But I also realized I did not want to become a doctor for the rest of my life, and I wanted to keep all my options open. And I studied economics in the Netherlands as well. And then the rest of my career so far, I have been really worked on the intersection of those two fields, the medical field and the commercial field. And I worked in the investment fund in the US, funding healthcare companies. Worked in a startup company in Kenya, which was a very rewarding experience. But most of my careers are help companies finance their R&D projects, raise capital, and also do mergers and acquisitions in the healthcare space as an investment banker in London. And today I lead the biopharma team for Europe in UBS. Good to be here.
So the ATiO Foundation is a relatively young endeavor to establish around the end of 2021. And we hosted our second annual conference in Berlin this year with great success, we can say, based on our feedback. Could you share with our listeners the story behind the inception of the ATiO Foundation, and also what pivotal experiences led to its establishment? What was really like the driving force that compelled you to initiate this venture?
Yeah, I can start on this. So as I described during my introduction, I work with companies across the healthcare sector, but I've always had a particular interest in the orthopedics field. And I think that goes back to a very interesting transaction I did on behalf of a very large orthopedic company called Smith & Nephew more than 10 years ago, where we helped the company spinning off their orthobiologics portfolio. And the reason for that was that Smith & Nephew is a huge company, and it's not a typical environment where R&D thrives. So they decided to separate out a very interesting portfolio of advanced products in orthopedics, allowing that new company to be financed separately with more funding from outside investors, but also to make more nimble decisions around the R&D projects that they wanted to fund. And that was a very interesting and rewarding experience. And that from one thing led to another. It got to build up quite a decent network in the orthopedic space. And sooner or later, I got to know a gentleman called Andrew Williamson, the CEO of the medical division of Reyes, a large family-owned German company. And together then with Tobias, we decided to fill some gaps that we think exist in the advanced therapy space in orthopedics. And I'll let Tobias add to that. But that's really the core, the essence of the inception of this initiative, which is to try to bridge that gap between, on the one hand, R&D scientists, ideas in the space, and on the other hand, commerce and financing.
Yeah, I can follow up on that. It was really a long process, actually, that led us to where we are now. I still remember us three, Michiel and Andrew and me, sitting together and talking about the shortcomings of the actual, or of the then still existing field of advanced therapies. Advanced therapies are cell and gene therapies, biologicals, new innovative products that are pushing on the market. And in the next few years, we will have an overwhelming wave of these products coming to patients. And this path is, in a lot of points of this path of the product from bench to bedside to the patients, is not really well understood, or the knowledge is very compartmentalized. So we have a lot of knowledge that you need for developing these products in basic research. We have a lot of knowledge in advanced translational research. In the clinics, we have a lot of knowledge about the medical problems that need these products in the future. And then we have a really great knowledge, above all, in regulatories and then in the business case and how to really position the products on the market in the industry. And then we have the strategic also knowledge of venture capital, who jump in at this moment already very early in companies and develop them. Also, the regulators have a lot of knowledge, and all these structures or these people, they really have not really a lot of opportunities to talk to each other. And this is something that we identified as the biggest need and the biggest problem. And this is why we then decided, okay, we want to establish a structure where we can bring these people together and to share their knowledge and to learn each other's languages in order to really have the best products in the end for our patients.
Beautiful. Maybe taking a step back, Tobias, you already talked a bit about the potential impact of advanced therapies. How do you envision those reshaping the field, and what transformations do these innovations ultimately bring to the lives of the patients?
The starting point is that we're talking about the whole musculoskeletal system, so the whole movement apparatus. And as we know, movement is life, and people will only live a long life if they and happy life if they can move. And so this is what we're trying to develop there. In the orthopedic sector is a very nice sector to explain these new products, because we are very far ahead with, for example, artificial implants. So new hip arthroplasty in the meanwhile is very successful. Also knee arthroplasties, shoulder replacements, all very successful treatments. But we have reached some plateau in these products. So we can replace in the end. So at the funeral of the joint, more or less, we have one solution. But the path until patient reach the funeral of their joints, for example, or also scarring in muscles or tendons after injury, this is a very long path. On this path, we do jump in with the new therapies. Advanced therapies allow us for the first time to really not only repair something, but to regenerate, as the name says in regenerative orthopedics or regenerative medicine, to regenerate tissues and to not only replace with an artificial metal or plastic or whatever injured or degenerated or diseased tissues, but really to jump in and say, okay, what's the problem? And I will tackle this problem, and I will restore the health to different tissues. And this is for gene therapies very easily explained. If you have a monogenetic disease, you correct one gene, SMA, for example, and then patient will not have the problem anymore, or to a much lesser degree. In polygenetic diseases, as is in the musculoskeletal field for a lot of times the case, for example, in osteoarthritis, this is much more difficult, and there we need a lot of knowledge, as I said, from the different fields in order to make these products successful. But these products will shape the field in the future, and it won't be the products that are on the market at the moment, because they have plateaued.
So the ATiO really brings together different stakeholders and key opinion leaders from all different fields and backgrounds. It's a really diverse crowd to please and really live up to everybody's expectations. The ATiO Foundation further aims to operate at the intersection of medical expertise and business proficiency. Could you elaborate on how you're bridging this interdisciplinary divide in practice?
Yeah, I'm happy to kick that off. First of all, which is really simple but very powerful, is we bring together about 100 people in one room for 2 to 3 days from around the world each year. And each of these people will be a leader in their respective field. And these fields are simply from science, from the clinic, from corporates, and from investment. Just by that very simple concept of bringing these leaders together in a room for a couple of days, that we can see generates a lot of ideas and initiatives on its own in an informal way. And that's just the beginning. And so then that's the informal part. But then there's also, during those couple of days, we've got more organized, more targeted initiatives. And then we have initiatives outside of the conference. But just give a few examples of the more organized modules that we have during the conference. One thing that I'm very fond of is that we invite about 15 startup companies that we've already pre-selected to present the highlights of their companies. And they're early stage companies, typically the CEO and the rest of the management team presenting the highlights for about 10 or 15 minutes to the audience. And in the audience, you have the leading scientists and investors and corporates. So it's a perfect audience for them. And it's perfect for the audience to understand where the new breakthroughs are. A second item maybe to highlight during the conference is that we have work groups focusing on specific topics. And these can be challenges in any of the fields in advanced therapies and orthopedics. For example, what are the most important products that are breaking through, but also what are the stumbling blocks of getting these products to patients. And then lastly, and this is not an exhaustive list at all, but then lastly, we also have leading scientists from around the world presenting what I think will be sort of the next frontier in the science projects in orthopedics. So that's very often it's quite early stage, but it's very interesting to hear about that, to build on that, and to allow that research to come to full fruition. But before I stop, the other thing I think is really important. This is something that goes throughout, is separate from the conference, but it's to highlight success stories in orthopedics and in advanced therapies. And just give one example, there's a Swedish company called Bone Support, started as an early startup company. Today, it's listed on the Swedish stock exchange and has a market cap of $1 billion. And it is those success stories that I think inspire investors to invest more in the space, and for corporates to do the same and to partner up with earlier stage companies.
Yes, and the success lies in this path of the product. The product will never succeed, or any product will have no chance on the market or in the patient if it doesn't work from the basic research approach. But it also won't succeed if for example, the surgeons would not like to handle it because it's so complicated. And also, you can't convince a patient of a product that they won't accept because of ethical issues or whatever. There are thousands of different views that you have to know about and that you have to discuss before you create such a pathway. And with the involvement of patients, for example, in our endeavors, and also with the involvement of very big experienced companies like pharma companies that actually did everything in-house in the former time, but also now are looking over the border of their big corporate structures in order to get this knowledge. With this involvement, I think we have had quite a success already in the past, and we'll plan to have that in the future even more in having this interdisciplinarity within the ATiO.
Speaking again of bringing better products to patients in the end in a more efficient way, and Tobias, you already talked about potential pitfalls during this multi-layered process. So what are some of the strategies of the ATiO in that regard to really push the limits of bringing products from bench side to bed in the most efficient way?
Well, the involvement of the different stakeholders is one of the critical points. And the co-working on specific problems, specific products, that is I think the core of it. The meeting, of course, is the nucleus of the ATiO that we held now for the second time. But the focus groups, for example, that discuss products, publications, that we plan to really bring this knowledge to the public and inspire discussions, are even more important also. Then we also include regulators in our actions. We had, for example, the immediate past head of the Committee for Advanced Therapies, Tina Schüssler-Lenz, at our last conference, speaking about the regulatory hurdles and also the regulatory support that somebody can get, opening the eyes of a lot of people. We have a lot of regulators also discussing then in focus groups at our activities. And I think with these strategies and also with then, in the end, focused support of collaborations for specific products, we will have a major impact on the field of advanced therapies.
Amazing. I think that was a really good highlight of the important aspects of what the ATiO does and can do. Finally, as we look forward, what are the aspirations and future objectives you hold for the ATiO Foundation? Or also maybe partly speaking about how do you envision the trajectory of the foundation in the coming years?
The principal mission that I see for us is to bring better orthopedic products in the advanced therapies field to patients and do it faster. And that is in itself a very simple statement, but I think everything flows from that. And I think I can give 3 examples of what we see as aspiration there, spread over 3 things. I think education of the 3 different of the various stakeholders. And when I think about education, one interesting fact is that the musculoskeletal disorders cause the highest disease burden of any therapeutic area. And it's something that probably is not so well known with investors. And clearly, if that is better known, investors will think twice about where they put their money. And so I think that is very important. I think secondly, when it is about corporates, if you think about a big pharma company, they invest in any therapeutic area pretty much, from oncology to dermatology to cardiovascular diseases to orthopedics. So there is a bit of a capital allocation decision to be made by these companies. And so if you improve education towards big pharma companies too, they understand that their highest rate of return will be in a therapeutic area where you have the highest disease burden. And so we'll make sure to invite decision makers at investors, decision makers at corporates, and then lastly also decision makers and the management teams of startup companies. And it goes a lot further than just giving them the opportunity to invest their company. It's also an experience for them to learn what investors and corporates are looking for in a startup company, whether that's the way their product is presented, whether that is the way that they have analyzed the market, or whether that's the way that their trials are conducted.
Yeah, I think what you said first, it's a very easy statement with the quality. You're absolutely right. It's a super easy statement, but the quality is so core and instrumental to the success of advanced therapies. We saw a lot of different therapies that were where we did not, or where we haven't had the biological knowledge that we have now and that we are building up. Therefore, we saw a lot of flaws and a lot of quality problems that really damaged also a lot of approaches. And now it's building up really on the basis of a huge biological knowledge also that we want to bring in, and also where we want to really foster this quality approach for advanced therapies. Concerning the political landscape next to the economical one that Michiel spun out is, I think one of the most important things surely is the dissemination of this knowledge. And for the dissemination of this knowledge, the ATiO intends to really stand as a stamp of quality and a place of knowledge for the development of new innovative products. And as such, we already laid out partnerships with larger societies like the European Foundation of Orthopaedics and Traumatologists, the EFORT, or the Tissue Engineering and Regenerative Medicine Society, where we signed already collaboration and partnership agreements where we as the ATiO will support in advanced therapy actually development together with the society, that are from basic research to clinical translation. And what the big societies in the future surely will make is that there will be really important dissemination factors, that this knowledge about these advanced products gets to clinicians, gets to patients, and also gets to the respective companies and gives them a place also to place their products and their ideas.
We hope you've gained as much inspiration and knowledge from this conversation as we have. Remember, the journey of innovation and progress is an ongoing one, and the contributions of visionaries like our guests continue to shape a brighter future for us all. Stay tuned for more engaging interviews and discussions. In the meantime, check out our website at atioalliance.org for more information and content. Thank you for joining us.